Today I shall be talking about osteomalacia. Osteo means bone and malacia means softness. And this bone becomes soft. This is also called adult onset rickets. In osteomalacia, bone volume remains normal and bone mineral density is decreased. This is most commonly seen in the females of developing and underdeveloped countries. As these countries have poverty and the women get poor diet with decrease in calcium and vitamin. And also they are covered from head to toe. So they have lack of exposure to sunlight. Also there are many drugs which can interfere with vitamin D metabolism. And vitamin D is necessary for the absorption of the calcium. And anticonvulsive drugs like phenytoin, phenobarbital, carbamazepine, and drugs that interfere with cholesterol metabolism like cholestyramine, as in developing countries there is lot of case of tuberculosis, so there is a high case of taking anti-tubercular drugs. Like rifampicin, they also interfere with vitamin D metabolism. Phosphate binding antacid, long-term intake of glucocorticoids as in inflammatory bowel disease and rheumatoid arthritis can also interfere with vitamin D metabolism. Now talking about the clinical features of the osteomalacia. Polyarthralgia, pain in the multiple joints, low back ache. As the spine and vertebral column has become weak, they cannot support the weight of the person. Polymyalgia. Talking about investigation of the osteomalacia. On X-ray, milkman's fracture, pseudo fracture is seen. This is most commonly seen in the lower limbs. Most common site is neck of femur. This is thought to be due to the pressure from the pulsating blood vessels to the soft bones. Triradiate sign is also seen. Triradiate pelvis. As this is normal pelvis, suppose this is normal pelvis, then in osteomalacia, pelvis becomes like this. In normal pelvis, it can retain its shape, but in osteomalacia, it has become weak. So bones has become weak. So this is triradiate pelvis. It is also called otopelvis. In blood investigation, calcium is transiently low or normal. Vitamin D is low. Phosphate is low. Serum alkaline phosphatase is high. And parathyroid hormone is high. As calcium is low, parathyroid hormone will become rise to cause bone resorption and maintain the level of the calcium. And for confirmatory investigation, we have to do trans-iliac bone biopsy. In this, white seams is seen. This means decrease in bone density. Now for the treatment. You have to give 6 lakh international unit, vitamin D, intramuscular, stat means single dose, or 60,000 international unit vitamin D daily once a week for 8 to 10 weeks, followed by two to 10,000 international unit per day for 6 to 8 weeks. And if the patient is on anticonvulsant drugs, then they have to take prophylactic doses, as anticonvulsant drugs inhibit the metabolism of vitamin D. And for prophylactic doses, minimum of 800 international unit per day should be taken. This is all for osteomalacia. Thank you. Now I will be talking about differences of osteomalacia and osteoporosis. osteomalacia, there is only decrease in bone density. So there is decrease in mineralization of the bone. But in osteoporosis, there is decrease in volume and there is decrease in density of bone. Talking about clinical feature, this patient is generally unwell. Chronic body ache. Muscles become weak. Fragile bones. But in this patient is generally well. Pain only after fracture. In this, curved body is seen, curved back is seen, and there is risk of fracture. This commonly occurs in adults, but this occurs in postmenopausal and the patients more than equal to 65 years of age. On plain X-ray, Luger's zone is seen. Not seen. Luger's zone is not seen. On investigation, calcium phosphate is decreased, ALP and parathyroid hormone is increased, but in this, these all remains normal. Lateral calcium will be transiently low. For treatment, in osteomalacia we give vitamin D and calcium supplementation. But in osteoporosis, bisphosphonates like alendronate, ibandronate, selective estrogen receptor modulator like raloxifan, tamoxifan. Calcitonin, denosumab is given. In this, calcium and phosphate is low. So calcium and phosphate is less than 2.4 millimole per liter. But in this, calcium and phosphate is not low. So more than 2.4 millimole per liter. Thank you.